Good morning, everyone. This is Dan Spots on behalf of the Dallas Area Chamber of Commerce. Welcome to Community Affairs. Our guest this morning, Shanon Saldivar, Saldivar Insurance, uh, speaking to all of the mysteries and challenges of the insurance market out there in general, and look forward to hearing more about that. We'll start with organizational updates going around the table, though, and today, as for the record, is the 13th of August, 2026. Let's start with Trish Neal, and then we will go to Bill Lennox.
Good morning, Trish Neal with Legal Shield, and August is Make a Will Month, and 7 out of 10 people do not have a will. And if you're one of those that do have a will, did you include your digital assets in that? And if you don't have a will, I would be happy to send you a free will questionnaire to get started. And I'll drop my information in the content chat.
Thank you, Trish, and please, everyone, feel free to do the same about any events coming up. Put those in the chat box. Bill, and then Corliss.
Good morning, everyone. I'm with North Central Public Health on the board, but I want to just a shout out to Shanon because I heard her speak at the Democrats at the POP meeting, and she did an excellent job. And it's unfortunate because I'm unfortunate only in the sense because it's such an important topic, and so I'm really excited to hear her a second time around. And I just want to let you guys know that I'm up in the twilight town of Forks, Washington this morning, and I'm really enjoying a break of being in the woods and along the coast. So I'll try to send you some of that nice kind of cool weather if you're so inclined. See you later.
I didn't recognize the background there, Bill. I was curious about that.
Yeah, that's right.
Thank you. Corliss, and then Heather. Corliss?
Good morning, everyone. Corliss Marsh here. I also too heard Shanon at the meeting, but I'm glad to hear it again because it has to sink in. So, no new updates.
And I'm going to be sure to notify the paper. I try to do that on our guest speakers, and they will listen to the recording and turn it into a story because it sounds like we have some good information coming out. Turn it over to Heather and then Julie.
Good morning, Heather Land, Communications Specialist at Wasco Electric, and I do not have any updates this week. Thank you.
Thank you for joining us, Heather. Julie, and then wrap with Leslie.
Julie Reynolds.
Julie.
I'm on the Fort Dalles Museum Commission. Nothing to report there. We're going to be having our meeting on Tuesday. And last night, the Historic Chapel Planning Committee met for our monthly meeting, and Gretchen reported that she is booking some really interesting performances and I don't know what you call them, activities for later in the year. Eric Gleason's going to be talking about his research with the Chinese community in October, and there's going to be a poetry reading. And in December, Catherine Clare, the Celtic musician, is coming back. That was a fantastic concert last year. Yeah, and there's some other things going on into the spring that will be really nice. So that's all I have to report. Thank you.
Great. Thank you, Julie. Julie, go ahead and put some of that in the chat box as well. We'll look forward to that.
Good morning, everyone.
And
I'm on
Leslie.
my phone this morning, so I'll mostly have my video off. I'm Leslie Naramore. I'm the Executive Director of Mid-Columbia Community Action Council. And the update that I wanted to share is just a reminder that we have our one fundraising event of the year coming up. It's going to be October 18th at the Granada this year. And so tickets aren't quite on sale yet. They'll go on sale in the next couple of weeks. So please keep an eye out on social media for that. Thank you.
All right, that's the 18th of September, Leslie?
October.
October.
Yeah. Yep.
Okay, great. Thank you. And just in time for an update, we have Mr. Roger Nichols joining us. Roger, you are muted right now. There you go.
All righty. Well, it's been a busy time and obviously people are already aware that we have postponed the county fair. since it was to start today, but in a level 2 zone, which could turn into a level 3 anytime, the thought of having to move thousands of people and their animals and all the exhibits on a 2-lane road at a time of crisis, no way. Did have one interesting offer. I got a call from Rob Van Cleve, the administrator for Clackamas County, and they've offered us their fairgrounds next week. We don't know if the logistics is going to happen, if that can happen, but that is an incredibly generous, because they're, as he put it, they're meeting their fair this week. And we'll just leave everything up, and you guys can come in next week. So that's incredibly generous, and again, awesome people to work with. Again, I don't know if that's going to happen or not. There's a lot of moving parts to be taken care of, but it's a fascinating offer. So thanks.
That is really cool. It
On
is a
top
great
of, I
offer.
just heard that 4-H, I don't know how true this is, but 4-H is going to have something this weekend at Hood River Fairgrounds.
I think they're going to do the judging so they
The
can get
judging,
in
yeah.
time for the state fair.
You know, when we're talking about fire-related issues and cancellations, I should also note, I've noted several times on community affairs that One Community Health celebrating its 40th anniversary on the 15th Saturday in Hood River, that is being postponed because of the smoke. The foundation event on Friday is still taking place in White Salmon. That's inside, and that's the only reason. So that's at the White Salmon Clinic, as I've noted before. And Shannon knows all about the One Community Health, having been a driving factor behind that organization for many, many years. All right, everyone, I'm going to turn it over with that to Shanon Saldivar, Saldivar Insurance. And Shannon, you are a co-host. You're muted right now, but go ahead and take it away. And
Perfect.
everyone, let's wait for questions until after the presentation.
Awesome. Yeah, I'm Shannon. It sounds like some of you know me and saw my presentation. It's similar with a few little changes because things have evolved a little bit since I spoke a couple of months ago about the 2027 landscape. I own an insurance company here in the Dalles. I also am on the One Community Health Foundation, and I'm on a board for Healthcare for All Oregon. I get to see every day firsthand what a negative impact folks experience by not having access to good health insurance and being able to get care when they need it. So I try to do whatever I can to help folks connect to it, but also work on solutions upstream so that hopefully things just get easier. I will share my screen, and I have about, I'd say like 10 minutes or so of content, 15 minutes, and then I'll leave some time for questions too. So, and thank you for your time this morning too. I appreciate it. Usually don't start my day. We start at 9 o'clock in the morning in the summer. So I was up a little bit early. That's to balance the 7 days a week during open enrollment we do. So, all right. Can everybody see my screen? All right.
Coming in fine, Shannon.
Excellent. Thank you very much. So I'm going to talk about kind of 3 different buckets of information. I'm going to talk about the individual market, which would be folks who don't have Medicare, they don't have group insurance, they're not on Medicaid, which we call Oregon Health Plan here. I'm going to talk about small group insurance, which is less than 50 folks enrolled. And then I'm also going to talk about Medicare. I have slides around that content. I can also speak to Oregon Health Plan and some other things if folks have questions that don't necessarily coincide with the slides that I've created. So here in Oregon, we have a really great transparent rate setting process, which this year more than ever was so important for everybody to be ready to adjust to what's coming down the pipeline for us. And in that transparent rate setting process, folks can actually chime in. There's public hearings, information's presented well in advance of when decisions need to be made. And in those initial rate filings for the individual market, for folks who don't have group insurance, don't have Medicare, don't have Medicaid, carriers filed a 9 to 28% increase in their premiums, which is one of the highest we've seen almost since the implementation of the Affordable Care Act. It's going to be a really challenging year for folks who don't have those other accesses to health insurance. This is coming on the back of 2026 plan year, there were some changes at the federal level on who can get tax credits, and also folks who remained eligible for tax credits, which is federal assistance to pay for the cost of their insurance, how much assistance they got. So 2026 was a really rough year for families. 2027 looking to be, unfortunately, just as rough. This was done when those rates were initially under review. Division of Financial Regulation has come back and adjusted one carrier down a little bit, another carrier up a little bit. So there is another layer, and things aren't completely final yet. There are still some public rate hearings that are going on, which is a really great, transparent way to see what's happening. Another piece of the health insurance puzzle, and this impacts not only individuals, but also small groups and large groups. The federal government sets the out-of-pocket maximum for health insurance plans. And what this out-of-pocket max represents is everything that's covered by your health plan. So prescriptions, hospitals, doctors, physical therapy, mental health, all of those things that our plans cover, and all of the dollars you spend as a consumer for in-network covered care are going towards something called an out-of-pocket max. And that's like a catastrophic cap. I think of this, if you had a really big health year, what would be your all-in? So that number's set by the federal government every year. And you can see the trajectory here over the last 2 years, 2026, and then moving into 2027, what the federal government has allowed those out-of-pocket maximums to bump up to. It's been an almost 30% increase in the last 2 years. And compare that to the trajectory in prior years. We had kind of marginal, 1%, 2%. We had 1 year that it went down, which was the first time ever. It was really nice to see. So families who are shopping for insurance or have insurance out there could face up to a $12,000 out-of-pocket maximum for one person, $24,000 for their family. And that's on top of these premiums that are just increasing so dramatically. A couple of really, really big disruptions in the insurance market. I'm sure y'all have heard this now. 2 big carriers are moving out of the market. They are canceling their plans. Providence, they are canceling their health insurance plans in the individual market, the group market, and we'll talk about Medicare here in just a little bit. Pacific Source is exiting the individual market in Oregon. That's going to leave pretty much 2 carriers for most counties in Oregon. Kaiser hits the Portland metropolitan area, but out here in rural Oregon, we have Regents and Moda. And in those carriers, we have one significant change. OHSU will not be in network with Regents for 2027. Really challenging for our clients here in rural Oregon, where we have to go to Portland to get our specialty care. Another unfortunate change with these 2 carriers exiting is if you're not in the Portland Tri-County area, Clackamas, Multnomah, and Washington County, there's not a plan available that you could buy that would cover Portland, Providence hospitals. We are going to see a huge shift, unfortunately, in where folks access their specialty care. And if any of you have had to access new specialty care anytime in the last 5 years, you know how challenging that can be. And unfortunately, how much time sometimes it can be to establish care with a new provider. So we are definitely going into a couple of years of just really challenging time in the health insurance market. Folks have been notified of these exits, the Providence and Pacific Source exits, and they, I'm going to talk, I don't have a slide. This Oregon is transitioning to a new marketplace in 2027. Right now, Oregon uses healthcare.gov to shop for insurance, and we are launching our new state-based marketplace, which is wonderful. I'm really, really excited about that. It's going to make things a lot more simple, and the transition's easier when we have these big exits in just this tumultuous year ahead of us. I don't think the state has received full federal release to get all their marketing material out there. So I don't have any slides corresponding, but the state's ready to go. Things are working really well. And with these 2 carriers that are exiting, the state behind the scenes is going to be able to map them to a new plan. So they won't be without necessarily, and folks will have time to make changes to during open enrollment, which is coming up right around the corner. A couple of areas in our state are going to be experiencing not only those increases that I listed for those filed rates, but they're almost going to have a double impact or a double increase. In many areas, the current least expensive carrier is the one that's exiting the market. So in these areas, those folks are going to not only lose the least expensive, which means they'll have to bump up, but also that carrier they're bumping up to is going up. So they're experiencing a double, and it's our area, Central Oregon here, is one of those areas that are going to have just significant increases in their premiums. I'm going to switch gears a little bit and talk about the small group filings for 2027. Again, this is folks with less than 50 employees. So a lot of our small employers here in the Gorge, I'm one of these that are going to be unfortunately experiencing these increases come 2027. You can see that the range of increases there, MOTA 22%, Pacific Source 25%. These are humongous increases. I say you can expect a 5 to 10% increase every year. That just unfortunately with inflation, cost of care going up, your demographic aging, right? Every year we get older, which is a good thing, but unfortunately with insurance, that means we pay a little bit more. So you're always going to have that 5 to 10% increase baked in. These are just really huge, and said what small businesses are going to be facing come 2027 when they start getting their renewals. I'm going to switch over now to the Medicare Advantage and just Medicare market. Fortunately, in some areas, Medicare is one of the more stable products out there right now. And there are kind of two different ways folks get Medicare or get coverage in addition to Medicare. The first route is you have your basic Medicare and you add in a Medicare supplement. Providence offers a Medicare supplement, and they have said that will most likely be going away as of 2027. Folks will be able to purchase a new plan, but your basic Medicare is kind of tried and true coverage is staying relatively the same, save for some increases in costs that happen every single year. In the bigger picture, Medicare Advantage, which is another way folks get insurance. And in this type of a program, an insurance company is now your primary payer as opposed to Medicare being your primary payer. And here in rural Oregon, we're limited. Every year we've had folks exit the market, and we're down to just a handful of carriers. And in some of those carriers, they don't cover your local hospital, which can be challenging. They're really network based. Two of our big carriers are Providence and Pacific Source. And right now, Providence is looking for a buyer for their Medicare Advantage business with information saying, they will let us know what happens, let patients or clients know what happens and whether or not they found a buyer and can transition or not. Pacific Source, which is one of our largest, especially here in Wasco County, has been a little elusive in sharing information. We normally would have had our trainings by now, but they have said they have some pending service area updates that they're not quite ready to share. And some things are bound by CMS, some things they can't share until the 1st of October. So we are waiting with fingers crossed that we still have good coverage here in Wasco County for our folks that are on those Medicare Advantage plans. And in this particular market, Medicare Advantage, my gosh, over the last 10 years, we've seen so many changes and really disruptive changes. Back in the early 2020s, some of our local hospitals stopped taking Medicare Advantage plans. I know Providence Hospital stopped taking the school district's Medicare Advantage, which is just so disruptive. We had MOTA, which was a really big carrier here in Wasco and Hood River County, exit the market in 2024, and folks had to change. So you just have this thing where every single year it feels like you've got to go back to the drawing board and redo everything, which is just so stressful and not fun. People don't like insurance, and I don't blame them. I don't care for it much myself, but I enjoy helping people navigate it. So this is my slide. I didn't want to bring just bad news, so I wanted to bring a little bit of hopefully some sunbeams in the future of what's happening. There are a couple of different entities in Oregon here who are working on ways to reimagine what healthcare might look like. And one of those is the Universal Health Plan Governance Board. I don't know if you've had any presenters here from that, but Dr. Mimi McDonald is the executive director of that, which is amazing. And Dr. Judy Richardson is on the board. And they are working right now to develop a plan. How would we pay for it? Who would be covered? What would the benefit design look like? And it's really, really exciting to think about what the future might look like when you don't have families who are facing 30% increases, 24,000 out of pocket for their health insurance, and just year after year, that added stress of, will my doctor be covered? Do I have to transition my care? There are public meetings that are still going on right now. There is a report that's due to the legislature at the end of the year, and it's really exciting to follow that and see what might be possible. Another Oregon-based entity, Healthcare for All Oregon. I'm on the board. They're also working and have been working for 25 plus years advocating for healthcare for all at the end of the day. And their role is really educating, advocating, and just being a resource for information on, again, what might that look like? What can we dream to make things a little bit easier, more equitable, and less expensive, to be honest, at the end of the day. And then my last slide, again, I didn't want to end on a super negative note. We deserve to have health coverage that doesn't disappear when insurers leave the market. And that's what we're facing this year again. So all right. With that concludes my official presentation, but I am happy to take any questions that are related to, the health insurance or things around that. I'm going to speak just one more thing. I didn't have a slide. There's some pretty significant changes coming to Medicaid, which is Oregon Health Plan. That's what we call it here in Oregon. There were some federal rules that said as of 2027, states had to implement a work requirement. So the states have to, as of January, every 6 months, find some sort of a mechanism that they're verifying that folks that are on these Medicaid programs are either working, going to school, or volunteering 80 hours a month. And one of the most nefarious pieces of how this rule was written is if a person can't get through that, which oftentimes it's going to be just navigating the system because it's so challenging, they would not be able to get tax credits to buy an insurance plan. So I think you're really going to see folks come off of that plan, not because they're not eligible. They are under the income threshold. They might be caring for somebody that just can't get the right piece of paper to the right place at the right time and come off of coverage. It's really unfortunate. And in the health policy landscape, a lot of the things that are shaping the landscape aren't fully implemented. So I also feel like we're at the midpoint in time in kind of negative health policy and negative trajectory for our health insurance system, unfortunately. I did end on a negative note, sorry.
Well, these are challenging times, and it's hard not to, and important that we try to address those, at least have an understanding of that. I wrote down about 5 questions here, but I'm going to turn it over to the group first, and I'll bet everybody has questions.
I have a couple of
Philip,
questions.
go ahead, Philip.
Thanks so much, Shannon, for a grim but good presentation. What would you say are the main reasons for this pretty terrible decline in access to healthcare is my one question. And the other question is, could you briefly speak to health shares as part of the healthcare landscape?
Yeah, definitely. So there are a lot of contributing factors, and the cost of healthcare has just continued to rise. It's rising so quickly. When the Affordable Care Act was first implemented, you saw kind of the cost go down in some areas. And the whole point of the Affordable Care Act was really to prioritize preventive care and kind of upstream things, right? So hopefully people get on medication, they get their mammograms, so they don't end up with big, expensive surgeries and treatment. the first couple of years, hospital systems made a lot of money, insurance companies as well. And though typically when we make more money in a business, we don't then reduce the cost of care, right? We expand and we build and we grow. So we've had just this growth. In the Affordable Care Act, which has been around and the main way folks are getting insurance now for 13 or 14 years, there have been some federal erosions to that program that have resulted in higher costs and kind of almost pulling it apart. We saw uninsured rates go up pretty significantly in 2026 based on some federal changes. And then with these two carriers exiting the market, that leaves two. So 50% of the market's going under. So the remaining carriers inevitably had to increase their rates pretty significantly in order to account for the fact that half the market's going out of business. Health shares is a whole nother thing. So health shares are a non-regulated insurance business. You can't even call them insurance. They're a health sharing ministry. Some have a religious component wrapped on them. Some have just a healthy lifestyle component wrapped on them. There's a lot of fine print. And as a consumer, if the plan doesn't do what you think it's going to do, you have no recourse. The Division of Financial Regulation can't back you. I don't sell any of those because I don't feel like I can adequately explain all of the fine print in the plans. I've had clients who've used them and who've been really happy. They understood the limitations. I've had other folks who were caught off guard by something. And more often than not, I've had folks who try to get specific information. I had some folks that do wind sports. They were kiteboarders and they said, hey, would I be covered if I was kiteboarding? And they said, yes, if you're following the rules. Well, what are the rules? Well, we just will tell you if you're following them, you're covered. So a little ambiguity in what they cover. And that's why the premiums are so much lower, right? Insurance works on risk pools. So if you have a product that's significantly less expensive than anything else out there, usually it's because they don't have to have the same coverage. In the plans in the individual market, the group market, and the large group market, they're standardized. The Affordable Care Act says they have to cover outpatient prescriptions, preventive, pre-existing conditions, mental health, maternity. So you won't have this a la carte, like, oh, I didn't realize this wasn't covered or that wasn't covered. And those health sharing ministry plans, unfortunately, don't have that same regulatory piece embedded in them.
Thank you. That makes
Mhm.
sense. And so you had some good answers to the increase of cost, and it's all in the context of the increase of cost of healthcare in general. I'm Swedish myself and spent part of the year in Sweden. Um, and so a follow-up question to that, why is healthcare so much more expensive in the US than
Yeah.
in most other countries?
Yeah, so that kind of segues into like healthcare for all or a universal healthcare plan. So I've been in the industry for 25 years, and in my time, things have gotten so much more complicated. When you think of a medical system providing care, they have to do contracting with sometimes 50 different insurance carriers, and each insurance carrier is going to have their own set of paperwork you have to file to be contracted initially, their own metrics that they're looking for that you have to bring up to the surface to prove that you did the care that was needed. You have medical coding, medical billing. So it's just a really disconnected system that leads to a ton of administrative work. It's just, it's insane. It's absolutely insane how many layers are in our healthcare system that are in between me needing to go to the provider and then my provider getting paid for the service they provide for my care. In between those two things, there are 10 different people sometimes, which is just insane. When you look at a single payer system, I use Medicare as one that's a single payer, right? National single payer health system. When I have clients who are on just your standard individual plan or group plan, and they transition into Medicare, and when they have Medicare with a Medicare supplement, which means Medicare is their primary, they're like, man, I went to the doctor. The doctor just did what I needed done. I didn't even get a bill for it. It's so simple when you take out all of the middle pieces in there. So I'm assuming, I don't know much about Sweden's healthcare system, but I would assume that it's more of a national payer system where you
Yes.
don't have, 30 different payers or 80 different payers that could be involved.
Okay, thank you.
Mhm.
Roger, you have your hand up. Roger, you're muted. There you go. Nope, still muted, Roger.
Okay, try that. There we
There you
go.
go.
I have a
Okay.
switch on my mic as well as a switch here, so it's too many switches for me. A couple of things I want to do. I'm going to mention this book, which doesn't show up very well.
Failure to treat.
Failure
I
to
think I saw it.
Treat by Peter Cowley, MD. This is the best book. I interviewed this guy, and this is the best book I've ever seen explaining exactly all the different problems with the medical system. So that's, and I'll put the link up, the information up in the chat in a moment. But I just wanted to mention that it's very, very concise and very thoroughly documented. On the other, and then the next thing I wanted to mention was that I'm going to be attending on next Monday. The Office of Rural Health and the Oregon Health Authority are doing the Rural Health Transformation Program and convening these meetings. This one is down at the Discovery Center and covers Hood River, Wasco, Sherman, and Gillum counties. It says it's going to be talking with all these organizations and to strengthen regional partnerships, support implementation of rural health initiatives, and prepare for future rural health transformation programs. So we'll see if there's anything in the future that's brighter than what we have now.
Shannon,
Thanks.
is that connected with the statewide systems that Mimi you had mentioned that Mimi
Yeah,
was involved with?
no, it's not. No, they're it's separate. So this is more like CCOs, like Medicaid, and like how our current systems are set up, like keeping that program together. Where Mimi's Dr. McDonald's, like that's more changing the whole entire system. So separate things, but got to keep the wheels on the bus before we replace it, right? So,
Ooh, great analogy. Thanks so much.
Other questions for Shannon around the table? Shannon, I have a follow-up question, and going back to the statewide discussion. There's a trend I know in the Northwest and sometimes extended to California to take kind of a regional West Coast approach to some of these broad issues. Uh, is there any has any thought been given to expanding? It's probably premature, but when Oregon starts talking about a healthcare statewide system, maybe
yeah,
make that
including other
West
states.
Coast.
Unfortunately, no. And it's so interesting. There's a push and pull. Like that seems great, right? Which would be selling across state lines or having plans that span state lines. Um, and that works good in that situation. But unfortunately, you have the alternative, which what we're seeing right now is even 2027 rules and regulations that came down from the feds loosened some of the consumer protections that were included in the federal Affordable Care Act. So you have states that are saying, oh man, if we don't have to cover this or we can remove that, we're going to. And so if you can allow selling across state lines, you're going to have carriers that's set up in those states where you don't have to cover the same things. And that just really like, oh my gosh, it's so challenging. So opening that up would, yeah, some things would be great, but you'd also have negatives. We here in Oregon, a lot of the protections in the Affordable Care Act were written into state statute. So even as those federal consumer protections get eroded over time, we still are protected here in Oregon. What you're going to see in 2027 and subsequent years is folks who work remotely. So if you have a company headquartered in one of these states that are taking the federal stance of eroding some of these consumer protections, your coverage is going to be different. If your kiddo goes to college in one of these states, and now we're right back to like one of the great things that the Affordable Care Act did is it really protected consumers from bad actors. There are always folks that want to sell you something that you might not totally understand. And usually the consumer's the one left with the bag at the end of the day, you know? We're going back to that a little bit with these federal changes and then states who decide to allow carriers to do those looser federal protections. So
That's unfortunate, but yeah, okay, okay. Questions for Shannon?
This is Bill. I have a quick question just has to do with, OHSU has been so much a part of our community for so long.
Yeah.
And I guess my question is, so many people just take it for granted. And so when they go and they present themselves for a treatment of some sort, will the, let's say the hospital let people know right away that in fact, OHSU is no longer within the system? How is that going to work for the consumer who's
Yeah.
approaching? Yeah.
Right. I think a lot of folks even right now don't know. So Regents, they actually lost their contract with OHSU at the end of 2025. But in that contract, they had a 12-month run out where clients would still have access for 12 months. So this was back in probably September, October of 2025 when folks were notified that OHSU is out of network as of 2027. I think, just like I mentioned, consumers are usually holding the bag. And two, like I do this full time, right? I've done this for
Yeah.
25 years. I had a family member who had a really serious medical emergency. When you have an emergency, the first place you go is always covered, regardless if it's in or out of network. But we were in the following week at the third place for tests and this and that. And we're sitting in the lobby and I'm like, I didn't check our network. And I do this full time. Like when
Exactly.
when you're in a crisis, you're not thinking, you're just wanting to get better and making sure your family or yourself is okay. So I know there's going to be folks who have a lot of adverse things, like ending up getting care that they have to pay the full price for, or I see it too, delaying care. So you don't realize your heart specialist is out of network until the day before your appointment. Now you have to find a new heart specialist in a whole different medical system. And I guarantee you the wait's going to be 2, 3, 4, 5, 6 months. So it's going to be
Yeah.
really, really difficult for folks. And that's part of one of just the really negative things that happen with how our current health system works, with all of these
Yeah.
different entities involved and this patchwork that we have.
It forces folks to be a little bit more aggressive when they make contact with the providers to sort of ask them directly, is my insurance going to be able to cover this or whatever? I mean, it's just going to
And
be,
they can't answer that. Like, well, that just highlights the disconnected patchiness that we have. If you call a clinic or a hospital, the front desk person that answers it, if you say, do you take Regents or do you take Moda? Moda has 7 different networks underneath of them. Regents, when you talk about that, you could have 100 when you think of the United States. So no, they end up saying you have to, contact your carrier, go submit a claim, go through this whole process. It's really,
oh my gosh,
it's so challenging. So
really going to be
challenging.
challenging for sure.
Mhm.
One quick other question, just because I'm naive about this. So if a person's going to, let's say, rebound, I mean, what's the relationship with, I guess that's rebound and would be through your Medicare and or your Regents if in fact they support it, right?
Yeah.
And a twist on that one, Rebound also is in Vancouver, so you have
Which clinic?
issue.
Yep. Yeah. Which clinic they're
Yeah.
at. And I think they have their own facilities, so you wouldn't have to worry. But I have some specialty providers that you not only have to check the specialty provider, but they don't do surgeries. They use a hospital to do surgeries. So you have to check the provider and the facility. And then another just complexity. I'm highlighting all the negatives right now. Rebound doesn't, when you search them in most insurance companies' networks, they're not listed as Rebound. They're listed as like Northwest Specialty Care. So even the way they contract is challenging to really get the information that you need to make sure you're being an informed consumer. So yeah, it's a fun times.
And I know from a hospital perspective, and that we're going to be seeing more and more of this as people fall off of policies. They wait, they eventually end up going to the ER.
Yeah,
They have no
definitely.
insurance. The hospital is required to treat those patients and eat that
Yeah.
cost. And
Yeah.
we're seeing rural hospitals go out of business across the United States, hundreds of them.
Yeah, I feel like if you we look back at this point in time, we're going to see that, Dan, just take a spike for sure. And we'll know why it is. It's this reason we're talking about right now. When folks delay their specialty care or delay, refilling their medication because they don't have a specialist or primary care or insurance for that matter, emergency care goes up.
Yeah.
Sure.
Roger, you have your hand up.
Yeah, I'm just really excited about the fact that you are really doing a great service by sharing all this information. It's this is the most cogent explanations I've ever run across.
Thank you.
So I
Agreed.
just want to pass
That's
on a
kind.
compliment to that. Also, I did put the name and also the front cover of the book in the chat. So, and again, it's worth reading. It's scary, but it's
Ah,
way accurate. Thanks.
yeah. Thank you, Roger.
All right. I have, this is Bill. Sorry to put my hand up, but one quick question has to do with since this is since Mimi's and Dr. Davison are really working on this, and you're a part of that process. What can individuals like us do to help move that along and support it, if there's anything?
You can write letters to your legislature to not let this let this die, and just keep pressure on our legislators for sure. The hope is that it's going to go to the ballot in future years, and at that point, healthcare for all, Oregon will be doing some grassroots. Like, we need to tell people about it. Oftentimes, there's initial resistance to universal healthcare. I think this year and next year, with just how challenging things are going to be, hopefully folks feel a little bit better about it. With the Universal Healthcare Governance Board, there are opportunities for just Oregonians to participate in the process and be involved in the meetings. There's subcommittees, there's hearings too, where they want to hear from Oregonians. So you can be a part of the process shaping what that future might look like.
Shannon, do you know whether there's any parallel discussion like that taking place in Washington State?
Not that I'm aware of. There is another state, but I can't remember offhand which state it was that is also having these conversations, but I don't know that Washington is right now. I'll be honest, I'm sometimes at my max, making sure I'm on top of everything that's happening in Oregon and then at the federal level. So I do this for fun, actually. I'll read that book, I'm sure, in the evenings. I study health policy for fun. So
To Roger's point, we're very, very glad that you do.
yeah, thank you.
Other questions around for Shannon? Well, Shannon, we still got plenty of time on this call, but I appreciate your time, everyone, for joining us. Again, this will be a good newspaper story. Roger, you're a fellow reporter on Columbia Gorge News. You're going to cover this?
Yes, unless you want to do it, because
Nope, you go ahead.
okay, we'll see what we can do, and I'll probably talk with you, Shannon, a little bit later about this.
Yeah. There's one piece that unfortunately isn't quite ready to go out to press, which is the state of Oregon's new enrollment system, Explore
Okay.
Health. Yeah, and
So
that
let's hold off until that's ready, but you
Yeah.
know how to contact me, and I will definitely do the story. Thanks.
awesome. Thank you.
Great. Thank you. All right, everyone. About 15 minutes to go here. I'm going to give a plug for the chamber. We have business after hours taking place at Freebridge's new riverfront location, Thursday, August 20th, 5 to 7, at 201 Osprey Lane West. And I thought I knew the Dalles, but I don't know of an Osprey Lane West. So somebody perhaps enlighten me. It sounds like it's on the riverfront someplace.
It's the old winery where what were they called? Los Lobos.
Oh, Lone Pine.
Tierra del Fuego. No.
Tierra de
Yeah.
Lobos.
Oh,
Tierra
Tierra
del
del
Lobos.
Lobos.
There.
Lone Pine. Okay. All
It-
right. All
yeah.
right. Cool. With that, everyone, enjoy the rest of your day. Stay safe out there. Let's hope that we get Grasshopper under control and goes away. We're tired of Grasshopper. Everyone, enjoy the rest of your weekend. Thank you for joining us. Our guest next week will be Debbie Jones on You Think. So stay tuned.